Mental health refers to a person's psychological, emotional, and social well being. And it affects the way we think, the way we feel. And then it can also influence our quality of life, our relationships, and even our daily activities. You're welcome back to this channel, Time with Miss Joyce Lynn. Today, I would want us to explore the world of mental health and wellness. Let's break the stigma and start a conversation. So, we are discussing schizophrenia today. This is a psychiatric condition that affects a person's physical and mental well-being. Schizophrenia disrupts how the brain works, interfering with things like senses, memory, our thoughts, and even our behaviors. Schizophrenia can disrupt how all these things are being done so that one may struggle with their day-to-day activities. Untreated schizophrenia can cause you to be disorganized in your thoughts and can also put you at risk for injuries. We have types of schizophrenia. At first, psychiatrists used to view schizophrenia as catatonic or paranoid, but these types weren't that useful in the diagnosis and treatment of schizophrenia. So, experts now view schizophrenia as a spectrum of conditions that includes schizoaffective disorder, delusional disorder, schizotypal personality disorder, schizophreniform disorder, and also specified or unspecified. Who does schizophrenia affect? Schizophrenia can affect any of us. If it affects men between the ages of 15 and 25, and affect women between the ages of 25 and 35, it tends to affect both genders in equal numbers. What I mean is that for some medical conditions, if it affects men in greater numbers than women, and vice versa. But in the case of schizophrenia, the rate at which it affects men and women are the same. It affects both genders in equal numbers. Schizophrenia in children is rare, but it's possible. And when it affects them during childhood, it's usually severe and harder to treat. Symptoms include delusions. These are false beliefs that you hold, even when there are plenty evidence that those beliefs don't exist. Example is you thinking that someone controls what you think, say, or do. There is also hallucinations, that is, thinking you can see, perceive, taste, or even hear voices that do not exist. There's also disorganized or incoherent speaking, disorganized or unusual movement, and also negative symptoms. Negative symptoms refers to the reduction or a loss of your ability to behave or do things as expected. Now, you may ask what causes schizophrenia. There is no one single cause of schizophrenia, but experts suspect there are three main different reasons why schizophrenia happens. And these three reasons are imbalances of the chemical signals that is responsible for cell to cell communications in the brain, brain development problems, and then loss of connections between the different areas of the brain. While there are no confirmed causes of schizophrenia, there are still risk factors that can predispose you to the condition. One is the environment you find yourself in. Secondly, development and birth circumstances such as preterm labor or low birth weight. And thirdly, the use of recreational drugs. Schizophrenia isn't curable, but it's often treatable. It is in a small percentage of cases that people recover entirely. Treatment also involves the combination of medication therapy and self-management techniques. These self-management techniques include psychotherapy, antipsychotics, and also electroconvulsive therapy, that is ECT. You can also do the following to help care for yourself and the condition. You have to take your medications as prescribed. You see your medical or healthcare providers as recommended. You don't ignore your symptoms. You avoid alcohol and recreational drug use and then consider seeking support. Schizophrenia can also throw you out of balance because of the negative symptoms you get. These negative symptoms can make you feel suspicious and paranoid at times, You might even forget about your personal hygiene. You might ignore your personal hygiene. You may feel depressed, anxious, or nervous. Schizophrenia can also let you have suicidal thoughts. It can push you to use alcohol, nicotine, and other recreational drugs just to ease the symptoms. However, if you're having the symptoms of schizophrenia, you don't have to avoid them. Just reach out to healthcare providers, especially those who specialize in mental health. They will help you in a manner that you don't feel judged, ashamed, or embarrassed. This is Time with Nurse Joycelyn. Subscribe to the channel for me if you've not done so yet. Like and share my videos, and also keep your comments coming in the comment section. I'll see you in my next video.